Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hey, what's up, fam? Dr. G and the lovely Dr. B. Welcome to another exciting episode of AMG Vitality Vault. Dr. B, happy to be here with you today.
Absolutely, my pleasure.
So today, You know what? I think I might have to change tone on you, Dr. B. I'm rocking my British socks today. Look at this, folks. This is Buckingham Palace Guard, and we did spend some time in England. We did train there.
We did.
Right. We watched a lot of BBC television. BBC. We certainly did.
You still watch a lot of BBC
I still watch
television.
a lot of BBC television. And thinking of BBC got me pondering about CBC. So I think today we'll talk about the CBC in your blood.
What's
up with your blood work? Understanding your complete blood count. Let's get this on and popping. So CBC is one of the first blood tests that we run as physicians, right? In the beginning, you do what? You do an electrolyte panel and you do a CBC.
Right.
Because you want to kind of get an idea as to what's going on.
It's groundwork.
It's foundational.
Most blood work, or whenever you go in for a physical or, a routine blood work, this is typically one of them. Yes.
Yeah, so it's a vital diagnostic tool that helps to look for different issues going on in the actual blood, whether it be clotting, whether it be red blood cells. Let's tackle each one and let's go through.
Let's look at the values here. So we have red and white blood cells as one of the first few values. And most people know about the red blood cells. They're the ones that carry oxygen from the lungs to the body. So it's responsible for, just making sure that whenever you need that extra oxygen, whether it be for working out or, something like that, that it delivers. Yeah,
to live.
So, and it helps you from not feeling fatigued. And so that's why, and we'll talk about, when those are low and what symptoms we can have later on. But going on to the white blood cells, these are the ones that are your guards for your body. They fight infection. They're like those British guards.
That's right.
They protect
the Buckingham Palace Guards, they are.
They protect things from coming in and destroying. So they help to fight infection diseases. And usually there's a differential count. So usually under the white blood cells, you'll see like leukocytes, lymphocytes, and there are different types of white blood cells that are responsible for a different function in the immune system. Your hemoglobin is actually representative of your red blood cells. The hemoglobin is actually a protein in those cells that carries the oxygen. The heme particle in there actually carries that oxygen and then releases it when it needs to. Hematocrit, again, is representative of your red blood cells. It's a proportion of blood made up of the red blood cells. So between your hemoglobin and your hematocrit and your red blood cell mass, you get a good idea of how much red blood cells and the function of the red blood cells in your body at that time.
So basically, long and short of it is, RBCs or hemoglobin is for O2 carrying, keeping you alive. And then the white blood cells are the police officers or the special forces that kind of fight off bad things that come inside you.
Absolutely.
There you go. So let's look at the other aspects. We have platelets and some other indices that people always see in the blood, and they do, well, I don't know what that means. So platelets, these are the tiny particles that help with blood clotting. And we use platelets all the time. So when you get a cut, and if you watch over time, a little scab forms, the majority of that is going to be platelets, along with some other things like fibrin, white blood cells, all those guys get together. But the platelets are the sticky parts that kind of hold that actual clot together. Now, when you look, you see the MCV, which is the mean corpuscular volume. A corpuscle is basically a fancy way of saying a red blood cell, basically. So we're looking at the average size of those particular RBCs. The MCH is looking at the average hemoglobin that you have per RBC, and the MCHC is basically hemoglobin concentration in the RBCs. Now, the RDW is a pretty easy and one that we like to look at when we're assessing for iron deficiency or any kind of disorder leading to anemia. Because what the RDW is, it's the distribution width of the cell. So it kind of gives us an idea as to how the varying sizes of cells occur. So whether it's too high or too low can give us indication as to what's going on. So if your RDW is too high, that's a random distribution with us too wide. It kind of points towards more of an iron deficient state that you could be living with.
So CBC is definitely important because it does provide some critical insights into your overall health and maybe the way you're feeling at the time. And even if you're not exhibiting any symptoms, it can actually aid in early detection of abnormalities and go hand in hand with other abnormal labs that we may see outside the CBC. So definitely, if there's something off, again, like we say, if it's a one-off thing, we repeat just to be sure that this is correct, that the value is accurate. And if it is, and consistently low or consistently high, we need to do further workup to see what is going on. So next, we'll be looking at, still with the CBC, we'll be doing diagnostic indicators. Like if it is low, if it is high, what does this possibly mean? What do I need to ask more questions about? So this, again, helps to guide in diagnosis and treatment. So let's look at the different values here. So anemia. I think a lot of people have heard about anemia before, or basically lower hemoglobin, low red blood cells. For whatever reason, it could have been a recent bleed that you had. It could be iron deficiency, whether it be from diet or some other factors. It could mean some other chronic medical problems. A lot of chronic metabolic disorders can cause anemia in different ways. Or it could mean failure of your bone marrow, where it's not producing enough of these red blood cells as it should be, and we need to figure out why. Now, there are cases of high red blood cells. So we call it polycythemia. And this could actually be a genetic problem.
Yes.
There's a gene that can control, a gene mutation that we look for that can cause this. It could be something simple as dehydration. If you come in for your blood work and you've not been drinking much lately, it could make your blood over concentrated, and so it could cause an elevated level, and that would be one you definitely want to repeat. And it could also be medication induced as well too, polycythemia, and some other metabolic disorders can cause elevation in red blood cells. What I typically see a lot, because we do hormone replacement, and I see a lot of people, especially in the men's hormone replacement, testosterone can cause elevated red blood cells. So that's something that we want to monitor for. So going back again to, medications and typical side effects, we want to make sure that these levels are run on a regular basis just to monitor certain indices.
So let's talk about the white blood cells, right? So whether it could be high, it can be low. So high WBC is what we call leukocytosis. A leukocyte is a fancy way of calling it a white blood cell, right? So when you have, typically the most common cause of high white blood cells is going to be an infection or some immune attack against your system, right? An infection. Any kind of inflammation can trigger a white blood cell count to go up. And the most serious episodes could be in the form of leukemia, which is a blood cancer, which is overproduction of white blood cells. And these are typically malfunctioning white blood cells in the system that can gum up the system and cause other issues. And if not treated early enough, can be disastrous. On the low side is called leukopenia. Penia meaning lack of, so that means a low white blood cell count. And this typically is seen in autoimmune conditions and also in times where the bone marrow is beginning to fail, or because of some disease process or infiltrative process in the bone marrow, it begins to kind of die down. And you're producing a lot less and less and less of these white blood cells. And that also puts you in a sticky situation, because what happens is you don't have the police force anymore. So you're left out in the cold with no police force, meaning no white blood cells to help fight against any invaders that might break into your system. So
and that happens a lot in cancer treatment.
That's right. That's right. Because typically when we use chemotherapy, certain agents will completely obliterate your white blood cell count just by the sheer nature of how they work. And that can be problematic down the line.
Okay. So let's talk about the hemoglobin and hematocrit, which are basically responsible for the oxygen carrying capacity in the red blood cells. So both low hemoglobin and low hematocrit can indicate anemia, which can be due to different things. Iron deficiency is probably the most common. You can also happen in B12 or folate deficiency, whether it's from a deficiency in your diet or from malabsorption. Higher levels can indicate polycythemia, which we just spoke about the different causes. So here we have a diagram that's showing the oxygen transporting in the blood via the red blood cells.
All right, so clotting and platelet abnormalities, low or high. So when your platelets are low, it's called thrombocytopenia. Penia once again means low or decreased. So that's what we have here. Okay, and many causes anything can cause low platelets. Autoimmune conditions can cause it. Once again, bone marrow disorders, and there are medications that can cause it too. One of the more lesser known causes in medications are actually NSAIDs, especially aspirin can cause your platelets to be a little bit lower than normal. Autoimmune causes ITP. That's a fancy one, immune thrombocytopenic purpura, which presents as low platelets with bruising on the skin. Now, for those of us who have high platelets, that's called thrombocytosis. So we have too much. And typically you can see a transient raise in platelets during times of acute inflammation. So you can sometimes see a higher than normal platelet count if you're fighting an infection or even in the beginning of autoimmune journey, you can see it rise up. That's your body's way of really reacting to that inflammation. So it's always good to repeat, like we always say, repeat the blood work just to make sure that this is a true representation of what the platelets are doing. Now, what you notice here in this video, this is basically your platelet function and how it works in clotting.
So let's look at the MCV, MCH, these other indices of the red blood cells, which we talked about. So if the MCV is low, can indicate iron deficiency, or there's an actual genetic component that's called thalassemia. It could be alpha thalassemia or beta thalassemia. And this is something that you have to run some genetic testing for. If this is something that is chronically low, it may indicate that you have one of those. If it's high, it could indicate B12 or folate deficiency, some liver diseases as well, and even excessive alcohol intake can cause elevated MCV. With the MCH and MCHC, low numbers can indicate hypochromic, we call anemia, which is basically lower concentration in the red blood cells, and most commonly caused by iron deficiency. And higher levels can indicate macrocytic anemia, which goes back to B12 or folate deficiency as well, or a condition which we call hereditary spherocytosis, where the shape of the red blood cells are more like a sphere instead of a concave that they're supposed to be in the middle, and that can cause dysfunction in the red blood cells. Again, another genetic test. RDW, we talked about, whether low or high, indicating the variation in the sizes. Yeah. So higher levels can indicate different things, like blood loss can be caused by different other blood disorders
Yes.
as well too, bone marrow dysfunction. So again, if these are things that are consistently low or high for the workup, would it be genetic or hematology workup or whatever specialist that you need to go to for the evaluation is needed.
And what's important is that we have to remember, never look at these indices or these parameters isolated
By themselves,
You gotta
right.
you gotta look at them in the whole clinical picture of what you're dealing with, and your physician knows this, your healthcare provider knows this. So, but for you, if you see one thing is abnormal, it's cause for I wonder why that is situation, and then you do a little bit more digging with your healthcare provider to figure out what could be causing that, or if it's just a one-off lab value that goes back to normal. I mean,
Right.
that happens a lot of times.
We don't want you to, see one thing and think, oh, I have leukemia,
Yes.
something
No.
like that. Of course, you're concerned, but you want to make sure that things are repeated
Yes.
and that it's looked in the bigger picture, not just one value.
Isolated.
And, sometimes we have people that have their normal is a little higher or a little lower than normal. And that's after we've repeated them, these testings. Like, for example, I have patients that had a little higher white blood cell count.
Yes.
Maybe just like a point something higher, and they've done all the further workup. We couldn't find anything wrong, no symptoms, anything, and so they just kind of live on the higher side. And remember, these lab values are based off the general population
Yes.
and the average of the general healthy population.
That is true.
So sometimes your numbers are just a little off. So don't get, too scared or, apprehensive if you see something just a little off. Just talk to your doctor, repeat some stuff, just look at it in the whole picture, except, not just isolated, and have that conversation.
What Dr. B is saying is, it's okay to be a little off sometimes. That's what she's saying. It's okay, guys. She tells me that all the time. It's okay to be a little off sometimes, so... All right, so CBC parameters are essential for looking at the hematologic and systemic conditions. So we need to definitely look at these, help them guide us to a diagnosis and treatment if necessary. So that was CBC.
That
Brought
was
to you by the
CBC,
BBC.
not
No?
BBC.
No? Okay, good. I'll stop.
Well, thank you guys for listening again in another episode of the AMG Vitality Vault. We thoroughly enjoyed it. We enjoyed every time. And hopefully we're bringing you very useful information that can help you in your healthcare journey and help you to speak more confidently with your healthcare provider about, your lab values and, what may be needed for further workup, etc.
And to help you take charge of your healthcare. We're here to guide, but this is your ship and you're master and commander. So thank you so much for joining us today on AMG Vitality Vault. We hope to see you guys next time in the vault so we can educate you even more.
See you later.
Take care.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.